Well, actually, you are the subject of our next story.
Oh,
we want to hear, because everyone wants to know how your recovery went and how you're feeling.
First morning back after that hip replacement surgery. You had the procedure on September 18th, right?
Yes.
Less than 2 weeks later, back in Studio 1A.
Al is going to tell us all about the recovery.
But first, we've got to get Harry Smith out and Dr. John Torres in.
Come on in, babe.
Hey.
Wow. All right, hey, guys.
Look at that.
Okay. So, Al, wait a second. You had surgery and you were up walking.
Yeah,
is that all in the same day?
Same day.
Wait, Dr. Torres, is that normal?
That's very normal. A lot of people don't realize it. You get up that same day, they want you walking, because we found out that if you don't do that, it's going to take a lot longer to recover. It's been, what, 11, 12 days?
Yeah, I went in, well, it's about less than a week.
Yeah.
A little more than a week.
Yeah, so it's fantastic.
Yeah, so, but it really, I had no pain. All the pain that had been there from the hip, gone immediately.
And that's what people say. They don't realize just how much you're going to be pain-free when it's gone, because you've been living with that pain for so many years. It's gradually been building up to the point where it gets intolerable, but you didn't realize just how bad it was until all of a sudden it's not there anymore.
You had a lot of stairs in your house.
Yeah.
Was it hard to do the stairs?
No, it wasn't. We actually did physical. I did physical therapy. In fact, that same day, did some stairs. And before I left the hospital, they did the exact number of stairs going up and going down, which is about 80 stairs.
Wow.
And I was able to do it. The interesting thing was, and I was wondering if this is unusual, Dr. John. Mine wasn't a long term. This happened like within 3 months. All of a sudden, I went from a little twinge to like excruciating pain.
And what happens is you typically compensate. And so the pain's probably was there on a lower level, just didn't realize it was there. And all of a sudden it gets to the point where your body's like, I can't compensate anymore. I'm going to let you know it's a lot of pain. And then it starts building up very fantastically like yours did, to the point where you need something like this. And you did the one important thing you need to do, and you mentioned it, physical therapy.
Yeah.
That's the most important thing you can do afterwards, is listen to your physical therapist, because they know exactly what they're doing, they know how to recover you, and they're going to give you exercises to use at home, which I'm assuming you're using.
Yeah, I've been doing
because
those.
they want you to do that religiously, because that's what's going to cause the recovery to be.
Did you get a deal? Buy one, get a hip free?
Yeah, I did a Groupon. It was great.
Dr. John, 370,000 Americans have hip replacements. Why is it becoming more common?
I think for a few reasons. One is we're living longer than we used to live, and we're much more active. If you think about our parents, hopefully you're not listening here, they weren't quite as active as we were. We do a lot of running, a lot of impact type maneuvers. That wears it down. We're living longer, and we're also a heavier nation, and that's part of the issue as well. And so that's wearing out the hip joints, the knee joints. That's why you're seeing much more.
Speaking of exercise, no one likes to ride his bike more than Al. I
can't wait to get back to
so
that.
when do you think that
I don't know. I'll
happen,
find out. I mean, I'm literally going to start for the last week, I've been doing in-house physical therapy over the phone, kind of like a Skype. But I'm going to the physical therapy unit today to actually start that. So hopefully it's within the next
When will we be back surfing?
It's like the old doctor. Will I be able to play the piano?
What about twerking? When will we be back twerking?
That will never.
I was asking.
You might be able to twerk now.
Are you going to set off the metal detector at the airport?
Well, I already do, because I've got 2 knees.
It's like a bionic Al.
I am. Here's a question, doctor. Is the median age of people getting these hip implants dropping?
It is. It's dropping. It used to be the 70s and 80s, 60s and 70s. Now it's 50s, even 40s. People are getting them, again, because we're so much more active. People are wearing out their joints, and that's causing them to have hip replacements. But like people like you, once they get it, they say, you know, I wish I'd done this a little earlier, because I'm so free of pain right now. It's fantastic.
Great.
Thank you, Dr.
Thank you, Dr. Torres.